Okay, guys, it's me. It's week four of Fortis's online class. We just finished the midterm. A couple quick announcements. So the email that I sent out wasn't actually directed at any one person because we didn't have anybody who really did that this term. Don't worry about it. That was about using work that isn't your own. They kind of want us to remind people, and I just sent it out as a reminder and as a notice that happens. So just be more mindful of those kind of things. I mean, you're going to get information from somewhere, right? And it's really cool if you use a reference. You don't have to go crazy with the APA necessarily. Those are just more work for you. So if you say, hey, I got it off of this book, and like just tell me anatomy and physiology and the author or something like that, or I got it from the book. That's always good too if you need to. You don't really have to. But that was, again, sorry for the inconvenience and the freak out because it wasn't directed towards you. It was directed toward other people. Actually, in previous terms is where this really did happen. And so we try to like nip it in the bud. Anyway, that's that. So this is week 4, and we're working on a couple things. It's going to be the heart and the lymphatic system and a couple other things. So your assignment this week has more of the same questions. I have some of the other old videos that go over that. This one too, we have what else? We have the lab, which is more like case studies. So this is a little different. No drawing this time. So it's just case studies, and they're going to look for things like troponin, and they're going to look for the CPK and all these kind of different chemicals. So look those up, and you don't have to even look those up. You can say, hey, what are the blood indicators of a heart attack, for example, or heart problems? What would show heart issues, heart damage, those kind of things. So there's a lot of different tests you can do. You can look those kind of things up and pretend that you're a medical assistant working in an emergency room or a clinic where someone comes in with chest pain and they have that same thing. Like little Angela there has a problem. It says Angela just suffered a myocardial infarction. Myo means muscle, cardiac means heart, right? So we're looking at infarct means basically a little part of it died. Okay, or what's called a heart attack. She tells Angela. Oh, the physician tells Angela she's going to take a blood sample so the hospital can perform tests to confirm the diagnosis. What information can Angela's blood yield to help the physician? So now imagine if you're the one who had to go and the doctor couldn't be there and said, hey, could you tell him what tests we're going to take? You're the one who's taking the blood, for example, and just go through that. That's all you got to really do. Keep it brief and easy. Okay, that's a good one too. Second one is a famous case of the Boy in the Bubble. There was a movie back in the 70s with John Travolta, who played the boy in the bubble back in the old days. Okay, so that's that one, and then that's the lab, actually. And then the assignment has a lot of different stuff. If you go on the assignment, it'll even have an idea of how to complete it exactly on their little tiny video, and then I have videos as well. So I'm hoping that everybody's did well, and we had everything turned in for the midterm. Let me look at our schedule and our stuff first from my point of view. If I go on my grade thing, you can't see this, but I can. Okay, I got everybody's stuff here. I am not missing. Oh, discussions are looking good. It looks like I got everybody's in. Labs are looking great. I only have like 2 or 3 people that haven't turned anything in. Nobody, it looks like, has turned something in incorrectly either. That's good news. The week 3 assignment. There's still 3 or 4 that I have to grade, which I'll be doing those tonight. Okay, it's a Tuesday night. And let's see, midterm. Oh, man, look at that. A lot of 90s. Very good job, guys. 75, 85s. Oh, these are really good scores. You guys did really good. Couple of them not as spectacular as you'd probably want, but let's see. Didn't even really affect that grade. Helped them out, actually. So some of the grades that they seem like, oh man, I only got like a 74 or a 72 on the test. It really didn't affect your grade as much as you think, meaning going down. It didn't affect it going down, and it looks like nobody failed it, so this is really good. And you can always take it again, right? And that should be open. If it's not and you want to, let me know. But we're moving along, and everybody's looking so good. I've got a lot of good, real high B's, 89.5, man. That's really good. Let me see the other height. The highest score in the class right now, you know whose you is and whose you is ours, is a 95.4, it looks like. And the next, 95.5 and 95.45. That's like a half a point. My gosh. 93.99. Oh, wait, no. We have a 98% in the class. Quite good. Well done, I must say. Keep doing the things you're doing if you're getting the good grades like that. 77, very strong grades. Those are good, man. That's really okay. 75, we're in the realm. Don't worry about it. You're just keep pushing. A couple of you a little bit lower than you'd probably like, but you know what? Let's push. The labs seem to be a problem. Those are always missing, right? In people who aren't doing as well. So let's work on those. That's my phone telling me it's time to be doing other things, but I don't want to be doing other things because I got to be doing this right here. And so we're going to silence that bugger. But let me see other grades. I mean, there's nobody specifically. I'm just bouncing around looking at it. Oh, some of it, one person had like a, oh man, 69.8. You need to lean 1.5 a point. Let's see what we can do, okay? Add a little bit extra to that discussion. It'll give us some more points. Add a little bit extra to that lab, perhaps, right? And gives a little extra points on that one. The quizzes and stuff, those are kind of fixed, and so is the assignment, because those are, you get a right answer or a wrong answer. But the rest of them are pretty good. I'm going to go through again. Look for your grades to change. Ooh, and I have something from a long time ago that didn't get put in. So we'll look through those a long time ago, meaning like Friday. So I didn't even see that. We will go through. Gosh, you guys are doing really good. I'm really proud of you. So I did send emails out also that said, hey, thumbs up, good job, or, let's work a little harder or whatever, and try to give you a little guidance on those. I do those routinely, or try to, and I do it. Those are personal. Those are individual, right? Those are individual to you when I say good job. Okay. And if I see something that says like, ooh, we got a problem, I will start with your name. I'll say like Sean, comma, hey, let's make sure and check on this in the future, make sure and do this thing. That's what I'll make sure and do. So that other one about plagiarism and not using your own work and that kind of stuff. So sometimes what happens is you can find these things maybe on Quizlet or something, and someone posted them thinking it was correct, and it's not. So be careful, because those things aren't really well verified. And sometimes people will just, this happened when I was in school too. You do learn from that if you read it, right? If you're looking through it. So try to learn from it and say, you know what? Let me look that up real quick. Take 5 minutes to look that one question up and just verify. And then you might even learn some more and get hooked on, the kind of learning ideas with those kind of things. That's what we're trying to do, is instill that sense of curiosity and that sense of, you want to learn and know more about this kind of stuff, because it's all about you, right? It is. I mean, this is your body we're talking about. You're talking about. I'm actually not scratching my butt. I'm fixing my chair. I'm using a stool, and it tends to wobble loose on me. I don't want to fall off onto the floor. Anyway, this is Dr. Sean over at the Fortis, and I want you guys to take care. Keep doing what you're doing, because everybody's doing so good. I'm so proud of you. And we'll talk to you soon, okay? Take care. Talk to you later. I'll give you another one this week, and maybe we'll go over something a little bit more in depth, maybe the lab or something like that. Thanks. Bye.